Today, we're talking about Azithromycin Vial with threaded port. This medication is an antibiotic used to treat certain bacterial infections. It belongs to the macrolide, erythromycin-type, antibiotic class and works by stopping the growth of bacteria. Azithromycin vial with threaded port is specifically used to treat lung infections, pneumonia, or female pelvic infections, such as PID, caused by bacteria. The daily dosage and optimal timing for taking this medication may vary depending on the severity of the infection, so it's important to follow your doctor's instructions carefully. Always consult with your healthcare provider for the best time to take this medication and the appropriate dosage for your specific condition. When using azithromycin vial with threaded port, it is usually given through a vein once daily as prescribed by your doctor. It should be injected slowly over 1 hour. If you are administering this medication at home, make sure to learn the preparation and usage instructions from your healthcare professional. Before using, check the product for any particles or discoloration, and do not use the liquid if either is present. It is important to store and discard medical supplies safely. You should only use this injectable medication until you are able to take an antibiotic by mouth or until your treatment is finished. The dosage and length of treatment will depend on your medical condition and response to the treatment. For the best results, use this antibiotic at the same time every day. Make sure to continue using this medication until the full prescribed amount is finished, even if your symptoms disappear after a few days. Stopping the medication too early may result in a return of the infection. If your condition lasts or gets worse, be sure to inform your doctor. Some common side effects of azithromycin vial with threaded port include nausea, vomiting, diarrhea, stomach pain, or pain/redness at the injection site. If any of these effects persist or worsen, it's important to contact your doctor or pharmacist. It's important to note that your doctor has prescribed this medication because they have determined that the benefit to you outweighs the risk of potential side effects. Many people using this medication do not experience serious side effects. However, it's important to seek medical attention if you experience any serious side effects such as hearing changes, swelling in the legs or feet, eye problems, trouble speaking, muscle weakness, signs of liver problems, or symptoms of oral thrush or a new vaginal yeast infection. In rare cases, azithromycin may cause a severe intestinal condition. If you experience persistent diarrhea, abdominal or stomach pain, or blood/mucus in your stool, it is important to contact your doctor immediately. Additionally, seek medical help right away if you notice any symptoms of a serious allergic reaction, such as fever, new or worsening lymph node swelling, rash, itching/swelling, severe dizziness, or trouble breathing. If you experience any other effects not listed here, it's important to consult with your doctor or pharmacist. Before taking azithromycin, make sure to inform your doctor or pharmacist if you have any allergies to macrolide/ketolide antibiotics or any other allergies. Also, disclose your medical history, especially if you have kidney disease, liver disease, or myasthenia gravis. Azithromycin may affect the rhythm of your heart, leading to serious symptoms that require immediate medical attention. The risk of this condition may increase if you have certain medical conditions or are taking other drugs that can also cause heart rhythm issues. It's important to discuss all the medications you are taking and any existing medical conditions with your doctor before starting azithromycin. Low levels of potassium or magnesium in your blood can also increase the risk of heart rhythm problems. If you are using diuretics or experiencing conditions such as severe sweating, diarrhea, or vomiting, it's essential to talk to your doctor before using azithromycin. This medication also contains sodium, so if you are on a salt-restricted diet or have a condition like heart failure that could worsen with increased salt intake, consult your doctor before using azithromycin. Azithromycin may also affect the effectiveness of certain vaccines, so it's important to inform your healthcare professional before getting any immunizations. If you are planning to have surgery, it's crucial to inform your doctor or dentist about all the medications you are using. Older adults and babies may be more sensitive to the side effects of azithromycin, so it's important to monitor their reactions closely. For pregnant women, azithromycin should only be used when clearly needed, and it's essential to discuss the risks and benefits with your doctor. The medication can also pass into breast milk, so consult your doctor before breastfeeding while using azithromycin. It's important to be aware of potential drug interactions with azithromycin vial with threaded port, as they can change how your medications work or increase your risk for serious side effects. It's crucial to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. It's also important to note that many drugs besides azithromycin may affect the heart rhythm, including amiodarone, chloroquine, disopyramide, dofetilide, dronedarone, hydroxychloroquine, ibutylide, pimozide, procainamide, quinidine, sotalol, among others. Be sure to discuss any concerns with your healthcare provider. Remember to take this medication as directed by your doctor and follow their recommendations for the best results. If someone has taken too much of this medication and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Your doctor may order lab tests while you are taking azithromycin vial with threaded port. It's important to attend all medical and lab appointments and consult your doctor for more information. Make sure to take each dose of azithromycin vial with threaded port as directed by your doctor or pharmacist. If you happen to miss a dose, it's important to consult with your healthcare provider to establish a new dosing schedule. Do not take a double dose to make up for the missed one. This medication should be taken at the same time each day to maintain a consistent level in your body. Be sure to follow the storage instructions provided with the product and ask your pharmacist for any additional details. Always keep medications out of the reach of children and pets. Avoid flushing medications down the toilet or pouring them into a drain unless specifically instructed to do so. When this product is expired or no longer needed, be sure to dispose of it properly. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.